Our next speaker is Carissa Weis.
"90% of us will experience a traumatic event in our lives. 90%. This can include anything from a car accident to combat, abuse, or the unexpected death of a loved one. The good news is, most of us are resilient after trauma, and while we may have a bit of a recovery period, we return to our normal lives. However, almost 10% of us will experience a prolonged period of distress and go on to develop post-traumatic stress disorder, or PTSD. Symptoms of PTSD include mental and physical flashbacks to the traumatic event, avoiding any potential reminders of the event, anxiety, and an overall difficulty to return to normal life. Early treatment after trauma exposure has proven extremely beneficial in reducing the risk of PTSD development. However, at this point in time, we do not have a very accurate way of identifying who is at greatest risk of PTSD development after experiencing a trauma. This is largely due to the many possible symptom combinations that vary person to person, as well as the rich and complex life histories we all carry with us. Research has shown that in those exposed to trauma, patterns of communication between different regions of the brain relate to specific symptoms of PTSD. People with long-standing cases of PTSD have different patterns of communication in the brain, even at rest, or when brain activity is measured while a person is lying in the scanner with no particular task or activity to do. This means that there may be some underlying or baseline brain activity that's apparent even when a person is not told to think about the trauma that could be a contributing risk factor to PTSD development. To better understand the brain's role in the progression of PTSD, my lab has recruited trauma survivors from around the Milwaukee area and followed up with them several times over 2 years. We want to understand specifically how the structure and function of brain networks changes in the aftermath of trauma. My research aims to understand if the pattern of communication in a person's brain just 2 weeks after experiencing a trauma can predict whether they'll develop PTSD months later, and if the pattern of communication in the brain leads to specific symptoms of the disorder, such as flashbacks or avoiding reminders of the trauma. If we can answer these questions, then we can engage trauma survivors in treatment plans before they even show symptoms and potentially stave off the onset of the disorder altogether. And if we can understand the connection between the brain and symptoms, then we can provide more targeted and effective treatments that more directly address symptoms of trauma survivors. Though trauma is often unexpected and unavoidable, understanding the brain's response to trauma can provide us with insights to develop better treatments so that no one must endure living with PTSD. Thank you.